Alright, let's talk about something that sounds a bit awkward but is actually fascinating. Why Dr. Samedi Mies tells you to put medicine where the sun doesn't shine instead of just swallowing it like a normal person. Here's the thing, your body has a very particular opinion about what you put in your mouth. When you swallow a pill, it dissolves in your stomach, gets absorbed through your intestines, and then, plot twist, it doesn't go straight to work. Instead, all that absorbed medication takes a mandatory detour through your liver first. And your liver? Well, it's basically that overprotective parent who thinks everything is potentially dangerous. It's designed to break down and neutralize foreign substances, which unfortunately includes your medicine. This is called the first pass effect. And it's kind of like paying a toll every time you want to get medication into your bloodstream, except the toll is losing a huge chunk of your drug's effectiveness. Some medications get absolutely destroyed by this liver checkpoint. We're talking about drugs where you swallow 100 milligrams, but only 20 or 30 milligrams actually make it into your system to do anything useful. The rest, filtered out and wasted by your overzealous liver. Now here's where rectal administration becomes the clever workaround. The lower part of your rectum has a special drainage system. Instead of sending absorbed substances through the liver's security checkpoints, blood vessels in the lower rectum connect directly to your main circulation highway, the inferior vena cava. It's like having a VIP backstage pass that lets you bypass the long queue entirely. The medication gets absorbed through the rectal wall and boom, it's in your bloodstream, mostly intact, ready to actually do its job. This is why some medications are way more effective as suppositories than as pills. If a drug normally gets demolished by the liver, delivering it rectally means you need a much smaller dose to get the same effect. It's more efficient, more economical, and for certain drugs, it's simply the smarter route. Think about practical situations where this really matters. You've got a toddler with a raging fever who's crying, thrashing, and absolutely refusing to take that cherry-flavored liquid medicine. Even if you manage to get it in their mouth, there's a 50% chance they'll spit it right back at you. A suppository? Problem solved, no negotiations required. And the fever comes down reliably. Or imagine you're so nauseous you can't keep anything down. Taking an anti-nausea pill orally is hilariously counterproductive. It'll come right back up before it can help. But a suppository stays put and actually gets absorbed. So yes, rectal administration might seem undignified, but from a pharmacological perspective, it's actually pretty brilliant. Sometimes the best way to get medicine where it needs to go is to take a shortcut and avoid that overly critical liver bouncer altogether. Your body has multiple entrances for a reason, and sometimes the back door is just more efficient than the front.